There's that wonderful little voice I love to hear. Well, welcome everybody. Thank you for attending this kind of visitor orientation. I believe from our roster, and speak up if it's not, but I think you've all provided this. You've been a visitor in the past. Is that true? No, some of you have not. Okay. Okay, I wasn't quite sure. For those that have been through this in the past, some of it might be a little redundant, but we'll go through it fairly quickly. But we have some new things going on. I also just want to share that we will also be sending everybody this presentation so that, you know, if it's kind of like, what was that said and how that go, you'll have that. Also, there's a couple of handouts that we'll be sending to you as well. We'll talk about that and I'll be showing those as we go. So Ryan's been really good about afterwards. Thank you, Ryan, for after we do these, just to send them out to everybody. So I just wanted to give you that heads up, okay? So we'll kind of get started and go through today. We're just going to kind of do a real kind of general orientation about accreditation. We're going to talk about the visits and from a visitor perspective, what to expect, what to kind of do. And we're also going to be taking a look at some standards. Probably the biggest one that we'll start off with is standard 1.1, which has changed this year. So I just give this as a heads up, is that we're working off of standards version October 2021, which is on the website. But we will also send that to you as well, as far as the most recent version. So, so we'll spend some time with 1.1 because that's probably the newest information. And if we have remaining time, we'll kind of go over a couple that have been some of our typical kind of bumps along the road with some camps, and then also hopefully just be able to open up for questions. So that's kind of the timing as we kind of move along. Once again, through this, if you have questions, especially if you're new, but also returning, if you have questions, comments, or actually from the returning, if you have helpful guidance for us all, that would be helpful as well as we kind of go through this. So here we go. So with this, I just always like to remind kind of what the purpose statement is for this accreditation program. And I won't read this. I've actually highlighted a little bit just to bring it out. But the biggest part about, or I want to say the philosophy of approaching this accreditation program, especially from COCA and I would say as a visitor, is really that it's considered an educational program. That really part of this is that we provide the information of standards and some of the backup really to help camps do the best they can do. And so really as we go in as visitors is just let you know that we've asked them to go through this information and we asked them to be reviewed ahead of time. We'll talk about that, but it's education along the way. We want to help camps to be successful. Also, with regards to accreditation, we're really there to help them take a look at their policies, their procedures and practices, and what it is specifically to their camp setting and population. The one thing that we have found out is that the membership of COCA is deep and wide, and there's lots of different ways in order to deliver the outcomes that COCA camps look for in enriching kids' lives with cancer. That can include families, it includes siblings, even young adults. And we also know that camps are in many different locations and in different ways that they operate. So it's important with accreditation that we enter in this with a lens of that we're helping them to identify this, but also know that all these are specific to how they operate. And as you take a look to review these and that kind of thing, please keep that in mind as well. The other part about accreditation that's important is that accreditation, the body and the spirit of accreditation, it really is about that we're taking a look at documentation and how these policies, procedures, and practices are delivered. That is really what makes an accreditation program. And rather than just saying, hey, we want to know how you do it, thanks so much, it's also seeing how they deliver. And that's where you guys are really pivotal as visitors, and all of our visitors are, is to really go and make sure that it's a verification process to say, this is what a camp's saying they're doing, that's great, and here it is in practice. And it's that extra step that creates some integrity to this program. Just as I say, accreditation standards are really about what they are as foundational elements. We know that in many of our standards that camps go above and beyond even what's kind of illustrated or asked for in some standards, that would be considered a best practice, where accreditation really isn't best practice, but it really is foundational practice, is the way I look at it. And further education within COCA really gets into that best practice as we move forward. The other thing is that as a reminder, that accreditation is really taking a look at the areas of practice having to do around pediatric oncology. There is, and we will be talking about standard 1.1, which is general camping, out of a request from many of our camps, as well as some of our visitors, and how we kind of handle that. But most of the standards really have to do with the practice of pediatric oncology camping. And as I shared a little bit earlier, that the wonder of this is that it's verified by a third-party observation process, and that's where you guys come into play, and we appreciate that. Also, just as a reminder, is that standards at this point, they are really written in the context of an overnight camp program and day camp programs. One-day experiences, those kind of things really aren't underneath the scope, even though many camps do that and do that very, very well. Or hospital-based programs. And many of the standards could be gleaned and used to make sure that they have their bases covered. They're thinking about all the things they should when they do these other programs, but they really are designed for overnight and for day camp programs. Questions about any of that? And I move on. What they are not is, as I say, they're not a collection of general how-to documents for an operation of a camp. And the second one is really, they don't prescribe a practice for a camp or judge what a camp does specifically, just that they have that covered. And by that, I mean is that for every standard, we ask, what does the camp do? And that's a part of their operation and their program on how they take care of that. What we ask for is, what is that? And does it cover certain areas? It can cover more than that. But these certain areas are considered important with regards to the delivery of an oncology camp, as long as they apply. And there are some that don't apply, but for those that they do. We do, as a aside, is that COCA does provide a vast resource of sample policies, procedures, and practices related to standards. Those are also available on the website, and also with regards to the portal, as we call it, the accreditation portal, which we'll talk a little bit about a little bit later, that those are there as a resource for the camps and as well as visitors. You know, and those can be customized, shall I say, to their particular practice, to their particular situation and their camp. All right. And moving right along, wanted to talk a little bit about timeline for this year, and we're excited to be back into actually visiting camps. I think at this point, I think we have, what, 10 camps? And I'm gonna let Ryan do that as I close my doors. I hear a big truck outside my door. Hold on.
We currently have 11 camps. We had 12 scheduled, but we just found out one is bubbling today. So we're at 11, and that's been a very fluid number as camps decide their policies, and some may bubble from here on out.
Thank you, Ryan. Yeah, that's true. And just so that people that have been involved with for a while know that I think we were going to be scheduling 29 camps to visit this year, according to our projection. And we definitely put it out there for those camps. Many of our camps are bubbling for the safety of their participants and their campers. And so in order to respect that health measure, we've allowed those camps that are bubbling, or because of this year, it's just difficult getting back into way, to actually postpone their visit. So right now it's at 11 camps for us to visit. And so still I'm happy with that number. And in many ways, it allows us then to kind of distribute the camps that were intended for this in further years, which hopefully, as we build this program, will become manageable, and we'll get everybody involved. So with that, we start off with mandatory orientations. Every camp that's going to be visited has been through an orientation very similar to this one. This is with a visitor lens, but just imagine doing this kind of presentation for camps and how they operate. So they've all been through this. We expect, and we're going to start taking a look at visitor assignments closely as we kind of as we move forward. We've asked camps to resubmit documentation, and I wanted to talk about that just for 1 minute, and I'll go back for a minute. But many of the camps that were scheduled for this year were actually scheduled for 2020. And then, of course, we all know about the pandemic and how that hit. But many of those camps had already gone through preparing their documentation, and we allowed them to upload that documentation and to be reviewed. And so some of our camps, not many of them, will already been through that process, but we have asked camps in this year in 2022 that those camp operators verify that they've gone through that documentation again and made any changes that were necessary, because things do change, including a standard, and that they do that in preparation for just being reviewed again, whether or not that's just reviewing what was done or whether or not if it's reviewing an updated standard. So, that's, we've asked camps to do that. We hope to have all the visitors assignments completed by May 1st. That way it will allow those visitors then to review documentation, have conversations with their camps that they'll be visiting, and doing all those kinds of communications, which we'll talk about. What I did want to do is I did want to go back a little bit to this visitor assignments. And you see down here, it says COVID precautions. So COCA has, Gold Ribbon has actually developed some precautionary information with regards to making sure that we keep our visitors safe as well as our camp safe. And all of a sudden I'm kind of going, I don't see that on my other screen. Let me take a quick minute, unless Ryan, unless you grab it quickly to pop up there. Let me see where I am here. I don't. Well, I'll pop on, and Ryan, if you can maybe take a look at that and what we presented, and maybe we can pop it up. We can talk about that in a minute, but we do have precautions we want you to be aware of as we kind of move forward. I'd appreciate your guys' support in doing that as I kind of just move forward here. As we take a look at this timeline and move forward, just want to let you know that once again, documents reviewed, accepted, we try to give that month of May to June to be able to do a majority of that. And hopefully this year, it'll also be a little simpler in that a lot of it has been pre-reviewed. We are asking visitors to just take a look at all those and become familiar with them, because they're going to be the ones that are actually going on site and know which of their documents or procedures or practices have been approved and how that pertains, so that when you're on site, you're familiar with that. Our on-site visits would be during this summer. The last part of that is we will be asking visitors to kind of provide a report. I'll talk about that in a minute. I do have that one here, ready to show you. And also to let us know about their expenses. If you do have expenses related to transportation, related to overnight stays, those kind of things, we just ask you in a timely fashion to please get that to us at COCA so that we can keep it in the same financial year and that we can reimburse folks appropriately. So really, we're just saying, hey, if you can get that to us 2 weeks after your visit, that would just be a good goal for you all to have. The next part of that is that once those have all been done, the Gold Ribbon Committee will meet in September. We even have the date to kind of reserve. And at that time, the Gold Ribbon Committee, one of their tasks will be reviewing all of the visits that took place in this calendar year. And with that, we will be discussing whether or not if there's any concerns about that, if there's any maybe differences of opinion, that we will research those, we'll present that to the committee, because at that point we ask the committee then to make a recommendation to the COCA board on which camps should be accredited. And that, once again, that goes to the COCA board later in September. And just so that everybody's aware, it's actually the COCA board that rewards or recommends, or should I say, recognizes camps with accreditation. It's not visitors, it's not the committee, but it's the COCA board. And then quickly after that is we will contact the camps. And so we just want to let y'all know about that. Questions about this? Okay. So rolling on real quick has to do with the goals of the visit. And once again, we're asking visitors to witness standards, policies, procedures, and practices with regards to their delivery of programs and activities. We ask that visitors go into that with an idea of, once again, not being obtrusive. It's not a special day at camp to have visitors there. Well, it's always a special day at camp, but not because the visitors are there, that the visitors are kind of in the background, just going through and doing the support work for that camp. Part of the goal of this visit is also collaboration between camps and visitors. This is one of the great things that we hear from our camps as well as our visitors. It's a great opportunity to see what other camps do, for visitors to learn from those camps, as well as to camps to learn from their visitors. It may be things that are not related to a standard, but just general operation, or it might be with regards to a standard as well. But it's a chance to have that collaboration and that continuing education. And so those are really kind of the three goals that we have out of a visit. As far as who's going to be a part of a visit, we've asked for an on-site team. We work with our camps as well, is that we ask that their camp director or the person that has been kind of working with accreditation for their camp, submitting the documentations, is familiar with that, is a part of the visiting team, as well as one of their camps, either doctors or nurses, whoever's in charge, but also familiar with that, as a resource to the accreditation team, as in the visitor team, as they go through their process. And so we work with camps just to make sure that the day they're there, it's not like color wars, the director has to be gone all day, because we might have questions for them. And so once again, just have them be available. And so that would be part of the team, as well as we expect one peer visitor and one medical visitor from COCA-I. Okay. In preparation for your visit, like I said, this is going to be given to you, but as a slide, but in preparation, probably I want to say the first thing is communication. We ask that as soon as you get that information on who that camp is, they will also get information with regards to you as a visitor, that we do that so that you guys can actually create a time to talk and to really make some plans for the summer. Some of that has to do with COVID precautions, and I don't know if we found those or not. Nope. Okay. I will bring those up before we're done with this, as I look at Jennifer and Ryan, to bring those up. But what we are asking is we are asking all visitors to be vaccinated and up-to-date vaccinations, whatever that up-to-date means for the type of a vaccination vehicle that you've taken, whether or not it's Moderna or Pfizer or Johnson & Johnson. We also ask that visitors take a PCR test, have results of a PCR test within 72 hours before the planned visit. And they have documentations for those, and they share those with the camp. And so that's one of the things we ask for. We also just ask that visitors try to limit their activity in those 72 hours of that PCR test and when they go to their camp. So, you know, if you're planning to go to a rave, it might be the thing to maybe reschedule that. But once again, we're not asking you to quarantine, but just to limit your activity and chance of infection after that PCR test. We are asking that visitors plan to mask, and we will give you that recommendation of what masks are, at least from the CDC in the United States. We also know that there are protocols in Canada as well. And we also ask that, and this is why I bring it up now, is because it's important that our visitors and our camps communicate about what the host camp's precautions are with regards to health and safety and COVID at this time. Are they going to require an antigen test when you arrive? What the masking protocols are, what that is, just so that you can be compliant with those as you walk into, as I say, their camp universe, and to keep their individuals safe, as well as our visitors safe. So once again, that's one of the things to put on the click list of communication. The other thing is selecting the best date. Once again, when all parties that I mentioned before can be available, and they can actually observe. It's not a good day on hike day when everybody's out of camp to have visitors there to observe what's going on because everyone's out of camp. But once again, seeing most of the activities would be great. We also actually talk about transportation. Closest airport, if you're planning, if this is a situation where you're going to be flying in, what's the best airport close to the facility. It may not be an international, it may be a regional. We ask that visitors be aware, just we're sensitive to cost, but we're also sensitive to time and trying to be there. So what is the closest place to come into? We also ask with regards to getting to camp, it might be providing rides from airport, or if you're driving in, once again, what's the best way to do that? We learned from one camp, as I put down here, ferry or rocket ship, because we learned from one camp, they made all these arrangements, they got there and realized they had to take a ferry over to the camp. It's like, well, what's that ferry schedule look like? What is that? And that hadn't been talked about ahead of time. And so that just is one of those things, just to clarify, are there any other modes of transportation to make sure that you get there safely? Also, we ask that if it is planned to have an overnight stay, either to come in beforehand or afterwards in order to conduct the visit, is to talk with the camp to see whether or not if they have the ability to support an overnight stay, whether or not if that's at camp, that could be possible. If you're fine with that, it's an adult situation, not putting you in with a cabin of kids, but it would be an adult accommodation, or perhaps there's a board member, supporter, or something like that that's not in camp, but be willing to have visitor for a night to spend the night. If that's not possible, COCA will reimburse for overnight stays and those kind of things. But we're always trying to work the budget the best way we are, and to do the most work with the money that our donors are giving us. So we asked you at least to have that conversation. And then the other thing to talk about is meals during the visit. Is that something that the camp can provide? Will that meet the dietary needs of the visitor? If they have certain restrictions or certain dietary needs, just to have that ahead of time to see whether or not visitors need to bring a snack, or whether or not if they can be a part of those meals, especially in these days. Questions about any of these?
Hey, Brian, I sent you, I believe it's the document you sent Ron and I for the board meeting. See if that's.
Oh, good. Probably is. Hold on, please hold. Have conversation amongst yourselves.
So sorry, it took forever.
No,
and while you're looking that up, Brian, given the possibility, the need for PCR tests and so on, is there any concern about people traveling by air after they get their PCR test? Should we plan, for instance, I'm looking at camp his kids out in Illinois, because I could actually go visit my sister in conjunction with that and help with costs. But I'm a little concerned, should I fly out 4 days ahead of time, or should I,
Yeah, it's a great question, Dave. And what we just ask you to do is if you're thinking about visiting afterwards, maybe a great idea to plan an extended visit after your visit, if possible, right, instead of before, therefore limiting your exposure to others. That way, if you can fly out, and yes, if you're staying the night there and doing that, and everyone is healthy and don't have symptoms, that's fine, just go and do that visit. But then extended stays, or if you want to go to a Broadway show, if they have those in Illinois, please plan to do those after. I'm sure they do. Please plan to do those afterwards would be the best protocol for that.
Okay, I was just trying to get a sense for how the travel, because I'm guessing that the airplane travel would actually be the most risky part of the excursion if you're not going to a rave or something. But right, how do you time that?
Yeah, and just to let you know is that we do understand that there may be a situation where people do have to fly. We're trying to limit that as much as possible just for safety. But if a situation is there, we just ask you to follow those precautions of safety, to mask, and then once again, just be aware of symptoms and those kind of things and going out. But we're trying actually on our end administratively to try to limit some of that as far as camps that visitors that may have to go far.
I figured, but I looking at the list of camps that are getting visited and where they are, I'm not sure if any of them are within 8 or 10 hours of me. So it's going to either be a long drive or a short.
And we realize that we're going to, because of where our visitors are and where our camps are, that we're going to have to kind of accept that kind of exposure and risk. Yeah.
Right. Well, and if it turns out that it's just not convenient, I mean, it's not safe for visitors that far away like me to come, that's fine too. I just want to put that out there.
Great. Thank you, Dave.
I think last year we had a lot more up and down the East Coast, but we didn't actually have them.
Yeah. Yeah, it varies from year to year.
Yep.
But good observation. Here's what I'm going to do is I'm going to pop this over in the Word document, and I will actually attach this, but just to let you know, this is kind of the This is a preview with regards to the precautions that we're asking. We talked about traveling and once again, being fully vaccinated. We talked about the negative PCR tests. We've talked also just about not having close contact with a large group or those kinds of things, or anybody with symptoms within 10 days of the visit, that you're not present with symptoms, even if you get to that location and all of a sudden you start developing systems, reach out to us, Ryan, myself, we'll reschedule, because we just don't want to have that, but we need you to be kind of that monitor for us. Once again, limiting activity where people go, those kind of things, is that adhering to pre-screen testings and everything for the camp. And then once again, we ask you to provide copies of those vaccination reports, negative PCRs to the camp. Once again, review their protocols, practice safe distancing when you're on that visit and doing that, as well as wearing masks and those kind of things. And there's recommendations here. And of course, hygiene and washing hands and all those kinds of things are important as well. So this copy of this will be coming to you as well. And sorry to quickly do that. Any questions about some of those precautions we're asking, since I have that here?
I have one question. Just I would imagine that there might be people who would have trouble logistically getting the results of a test within 72 hours on time. Do we have resources we can refer people to for rapid turnaround testing, or do we have a plan?
Great question. We will develop one, because we don't want to have one at this point. But knowing that if that in fact is an issue, we hear that, and we'll get back to you with regards to if we need to reimburse for a PCR test that is a quick turnaround, and see what that option is. Thank you, Dr. Mike. Any other questions? Okay. Well, I'm going to do that, and then we're back. All right, just what I'd like to do too is just kind of talk a little bit about the overview. So we do on a visit is, once again, we ask you to take a tour of camp, see things in action. Once again, show us what you do is kind of what my mantra in going out and doing visits. You definitely want to observe the medication administration, the medical services in action. So how they do that, where they store that, all those kinds of things, just to make sure that they're actually practicing what they say their procedures and practices are. This is also where we've tried to give some guidance, because some of our visitors have also said, hey, so what are those things that we really have to visit, and those kind of things. So what I want to do is to share this with you, is that we actually, and this is actually, oh, is it going to work? Please work. Let me put this back and say if it works there or here. Oh, it does work. So inside the standards binder, you will find as a part of that what we actually call a visit worksheet report. So with this is something to help out a visitor and also to communicate between visitors and your camp. But once again, this is a kind of a checklist where you can go through the different standards and say whether or not the documentation's been seen. And we really try to say that we'd like to have it all seen before the visit, even though it says that the document's not been seen, if there's a last minute follow-up. But really, we're really trying to work and asking you to work with the camps to make sure that everything's seen. And then there's even some boxes here that are open that just says, hey, have I observed these in practice? For instance, what's their camper intake application? How do they do that? Staff training, even talking to a staff, hey, tell me how you were trained, to see if that meets what they say their documented procedures, protocols are. Orientations for short-term guests or staff, if they have those. Are the healthcare policies on site, and are they aware of where they are, both from a medical end as well as an administrative end? Staff and volunteer medical histories, are they available should they be needed? We also have the healthcare protocols, emergency plans, and you can kind of see that there's some others going through. So this is really made to kind of be a guide for visitors. They go on, what do I really need to see? Because it's hard to see, hey, does your camp have a coordination with other healthcare providers when you're on site? That's really a documentation piece. It's not something you have to be when you're on camp or looking at. So we tried to make this most succinct. So once again, we will get this to you as well as it is in the standard binder as well, just to kind of help that day of the visit. Questions about that?
Do we need, yes, I have a question. Do we need to submit that with a written report? Or is
We
that
asked-
just for us
yeah,
to separately while we're going through the camp?
Great question. And what I would suggest is just to make it easier on that is you can go through, you can click those off. You can then send that in. There's actually a place for visitors to sign and even the camp to sign. If they wish, if there's further narrative, you can also send that in as well as far as a report. But that can be sent back as well, just easier to take care of.
Can I ask a question?
Yes.
Sometimes, I don't know if it's a question. Anyways, sometimes the medical people, we'll ask about, I think on the standards, it lists things like staff medical history or family stuff. It has different things. And sometimes the camps will say, oh, we don't have that for you to look at. It's just in the computer.
Sure.
Um,
And it may be electronic, but the question is, do they have access for that? And could you see one?
Well, that's something that if we could give them notice that we will want to see it, even if it's online, because some of them are like, oh, yeah, and then it
Yep.
takes forever. Then they have to go get the computer and set
Understand.
whatever. So that was just something
Note taken. We did review that, but we will highlight with that.
that was something that came up. Yeah.
Yeah. Good point. Others? Cool. The other piece is we have let camps know that as visitors, that will be having conversations with others. It could be counselors, program leaders, other healthcare providers, because that's a tool for you to kind of find out what actually they do. That's like, I love to ask staff, what do they love about camp? And then how were they trained? Just to find out what that process was, rather than just the director who does the training. This is actually saying it was actually performed on this group. So we let camps know that, not to be intimidated, but just to let them know that that is a sample of the types of third-party verification that may be happening during their visit. So they should just be aware and not intimidated of, why are you talking to my staff? So anyway, so we just want to let you know that was something that came up in the past. It's kind of to be able to educate them that visitors will be talking to others.
It would probably be, do you also let the directors know that we would like to talk to your staff and let your staff know? Because I can envision a staff member thinking, well, I don't want to rat them out. Although some of my staff probably would, but
yeah, well, it depends on the camp. But yes, we have let them know just that that this will be done and that they should be aware. We haven't let them that they ought to broadcast that to their staff. That's a good note. That for the future is that maybe we also include that in their orientation of notifying.
Well, I think if the staff realize that the whole idea of the visit is not to catch them doing something wrong, but simply to help make sure they're doing everything they can to be safe, and that if a staff member, for instance, said, well, we didn't specifically talk about sexual abuse or whatever, then we're not going to. It's not going to cost them something major. It's going to give us a chance to make them better. So I think my staff would be more.
It's not trying to catch them doing something wrong, but instead catch them doing something right.
Right. Or help them see blind spots, because I think my staff, for instance, would be more willing to talk openly if they thought it would make camp better than if they thought they were going to get me in trouble.
I appreciate that. Thanks, Dave.
Most of them, anyway.
Yeah, most of them. Great. Some reminders for the visit as well is the lens we asked you to go into is as a visitor, not an inspector. And those of us that run camps, we know what it is to have inspections. We get them every year from the health department, those kind of things. And many times they're kind of, as I think, Dave, you tried to say, it's kind of like you're protective and, oh my gosh, we just want to make sure it's okay, compared to that this is really a process to do better. And it's really a visit to observe those written procedures. And so we ask you to enter this in with those lenses as a visitor. Is that you're a visitor to do that and to help them do things better. We do mention down here professional conduct. The people that I see on this call, I'm not worried about, but just understand that you are representing COCA. And so we just want to remind you of that. We do also remind that visitors of confidentiality. This has to do with documents. This has to do with photos, videos, all that. I know that when I do visits, many times I see something that I love to do and I want to take it back to my camp. Please ask for permission and understand if they say, no, I'm sorry, please don't. Also with videos and photos, also know that they have campers that are there and there's privacy and confidentiality issues also with our participants. And so be aware of that. But if you do see something and they're willing to share, you know, you can ask for it offline, but don't just kind of, you know, take their information or take those, make it open. It's really great for a camp to know they might have a resource that you would be interested in, but we ask you to just be respectful of that. Difficult conversations, you know, these are a part many times of these processes where you go in and viewpoints are very different. And that could possibly happen on your visit. And if so, we just ask you with the most decorum is to be able to represent COCA. And that really what we're trying to do is whatever they say is their policy, their procedure, we're just taking a look to see whether or not if that is being followed. And sometimes it's interpretation about what that document is or what it should say. That's why a lot of the documentation we like to do up front and ahead of time to try to kind of avoid some of those. I would also say that you might see things at camp that maybe aren't involved with standards that maybe you're interested in or maybe you have concern over. If that is true, please understand, and I would say literally in front of them, take off your COCA hat and you can have that conversation. Hey, here's something I've learned from my experience. I'm wondering how you do this and that and the other, and have you thought about this, that, and the other? Because that is the collegial opportunity between a camp professional and a camp volunteer to another camp professional and volunteer just to do that. But with regards to COCA, we really ask that visitors take a look at what do they say they're going to do, even though I may not do it that way at my camp, and we found that it works better this way. I understand that, but that's a secondary conversation to what do you say you're going to do? Has that been approved and is that what you're doing? Then the next conversation would be, hey, this is something that we've learned and you may want to consider. And that's a mentoring opportunity. And I understand that that's a hard sometimes concept to understand, but I ask you to try to wrap your head around that with the good of being able to show that we're consistent with regards to COCA, but we're also collegial and we're also an education forum as well. Questions about that? If there are disagreements with regards to what's seen or what a document says, definitely if you have to just agree to disagree, that's okay. And I ask you to do really that. Will we just agree to disagree? Document all of that, turn that as in a report, and they will have members from the committee and staff that will actually follow up on that and try to make a determination with regards to that issue in their accreditation. Okay. And then, as we said, kind of complete that visitor worksheet with signatures would be great, and submit that and any other information that you have with regards to your visit. That will help us to then kind of evaluate as we go forward. At this point, we're going to talk a little bit about the portal. We're actually going to say that's on hold. We have a wonderful consultant named Don Golden, who is still working at getting that portal just tweaked right to make sure that all the camps in 2020, their information has transferred over into the new portal site. So we have a commitment that that will be done in the next week or so, and that we'll also provide video instructions on how to do it. If you've done the portal in the past, it should be very similar, hopefully easier, but we'll also have video instructions going through that. And if necessary, we'll have another quick seminar for those that just want a quick tutorial on the portal. Okay. The one thing I did want to say with regards to that, we have asked camps, and we spent quite a bit of time on this, of when they upload their documentation, we ask them to be really specific with regards to that standard, not just to say, well, here's all of our policies and procedures, there's a 104-page document. There everything is, go there, you can look in there. But instead to guidance, even if it's look on page 4, paragraph 5 for this one, better yet is we ask them even if they could take that highlight it, scan it, and say, here's the information directly needed for this standard. It makes the review of that standard and those kind of things a lot easier. So we've kind of tried to coach our camps to do that. And I would even say that as a visitor, if you do find yourself having to review a lot of documentation, that if it's not that way, feel comfortable to approach that camp, and we'll back you up by helping them through and saying, could you break this down a little bit more so I don't have to read 104 pages of your policies and procedures, but know what directly answers this, to make sure that I find it and that it's clear with regards to how you're answering or how you're complying with a certain standard. Okay. Questions about that?
I have a general question to go back to the site visit itself, if you don't mind.
Sure.
And my question is, based on people's experiences having done the site visits before, is it more beneficial for the medical visitor and the general camp visitor to travel together separately? What tends to make the most sense in terms of being effective, having the collegial conversations, et cetera?
Present that to the group. Ideas.
When you say travel, do you mean like actually to get to the?
Within the camp, while you're there doing your site visit.
I did all of mine with my, I'm a nurse. I did all of mine with the other person. I started at camp as a non-medical person, so I have that background as well. And I was taught by the greatest camp director ever, Brian Crater. And so we walked together, and it was very helpful because even though you have medical and non-medical, so to speak, we all are medical in a sense because we've all been doing cancer camps for however long. So it was nice for me to have another set of eyes and vice versa, I think.
I would agree with that. I think there are sometimes situations where things are scheduled in a way that it's hard to get everything you want done unless two people are in different places at the same time. But where it's possible to have the team sort of all together, you can bounce ideas off each other, and it adds depth and experience.
Yep, I agree. Did mine all together, and even when we sat down at the table to go through those documents that we needed to see, the nurse sat on one side with the medical person, and I sat on the other side with the camp director as the peer visitor, and then we could have conversations back and forth if we needed to talk about those documents. So that was good.
Great, thank you.
And I did have one comment about the concept of citing individual standards. I think you're absolutely right, Brian, that to be able to point somebody to specifically what language in the document is they're trying to get you to read. The other side of that coin is that when a camp goes through and creates a separate document for each standard, and they never kind of try to put it together into a coherent whole, I think from a best practice standpoint, that's not the optimal way to do it. So we definitely don't want to, in the language that we're using, discourage them from having that 104-page document or whatever. But I think you're absolutely right that pointing you to what you should be reading, as opposed to saying it's in there somewhere, go find it.
Yeah, you tell me what page it's on. It's in there. Great, that's helpful. Thank you. And I know we have less than 15 minutes left to go, and I did want to get to 1.1, but just as a general with regards to the standards, we have definitions. Definitions have been expanded this year to include some others. I'll mention those. So just something to take a look at. And then we have the sections that are the general clinic affiliations, administration, staffing, healthcare, psychosocial support, that are then the different sections of the standards, just how they're organized. And then within those standards, it's important for visitors to take a look, not just at the standard, and it's also for the camps, but not just take a look at the standard statement, but also the intent. The intent also provides some guidance with regards to what we are asking of the camp, that apply as long as it applies. And so for a visitor, just to make sure that those pieces are also addressed with regards to compliance and observation or written documentation. So, be aware of those intent statements as well. Moving forward, I would like to spend some time with regards to 1.1. So 1.1 is the first standard off, and it really has to do more with general camping practice. And the Gold Ribbon Committee and staff has taken a lot of time to take a look at this to figure out how do we really want to do this. Our camps have really said to us we need some more guidance with regards to the standard of how do we know that we're really meeting what would be considered general camp practice or acceptable camp practices. And so COCA has actually developed and actually reviewed this one standard and has done an update in this new October 21st version of the standards that we're asking everybody to follow for this cycle. And so just to let you know that to kind of break this down, the member is asked to offer whether or not if they're programs and facilities. And I say that both because some of our camps run programs and rent facilities. Some of our programs have both a program and facility. And for the case of this standard, both of those need to be considered with regards to this, that whether or not they offer both programs and facilities, and once again, if they meet organized camp standards. Now, organized camp standards, we'll talk about that definition in a minute, but let me go down to the actual intent. And so it says that all aspects of the camp program and facility operations are basically required to meet generally accepted camp operation standards by holding accreditation of a recognized camp association, of a professional, jurisdiction. I'm backwards. Accredited of a recognized camp association. Thank you. And just to let you all be aware is that we actually in definitions have defined what a recognized camp association is. And so those are the American Camp Association a part of that. There's Canadian camp associations that are a part of that. So if they hold accreditation from those and that they cover both their programs and their facilities, then they are compliant. If, for instance, their camp facility is accredited, but the program, the member camp program is not, or the situation where neither one of them are accredited, either the camp program or the facilities, then we go to the second section, which is they need to provide evidence that the camp meets criteria of local jurisdictions, which can be health departments, licensing agencies, we'll talk about that in a minute, or provide written description of access with aspects of this program and facility operation. So if they're not accredited, that's okay, because many of our camps are saying we don't want to go through accreditation, but what do we really need to be looking at? That then they need to either meet the criteria of their local jurisdictions or provide written documentation with regards to the aspects of their program. And then this actual standard has then been illustrated even more like this. And there's a lot of information here. I don't expect you to go through it all. But what I did want to say is that, by the way, this is the definition of what accredited recognized camp association is. It is within the standards. So these would then apply. But then for these two, so we did it in program and we did it with regards to facilities because we know our camps, the complexion of our camps maybe one or the other, either as accredited or not accredited. And so we wanted to split those apart. And we also provided a resource. So within the standards, there is an appendix that then takes a look at each one of what these bullet points are and what they need to consider with regards to writing or finding compliance or writing procedures with regards to that. To let you know what that looks like, I'm going to do this because I actually brought this out and we'll send this to you separately. But Appendix 1.1, for instance, talks about staffing procedures. So if you're not accredited with regards to your staffing procedures, so these need to be known. So it's for volunteer and paid, what their screening, training, including child abuse prevention, skill verifications, all those kind of things. So it says now documentation or descriptions could include these. So it really gives them kind of a menu of how to comply. This is also with regards to supervisor qualifications, aquatic activities, supervision and training, job descriptions for their aquatic directors, program equipment management. Is it regularly inspected? How is it controlled? With regards to program safety for each one, are there safety procedures that are written? Are there emergency procedures that are written for each one of those activities? And then transportation, how they deal with transportation, once again, for each one that may apply. So this kind of walks through some of the things that they need to take a look at for compliance for this and for those that apply for them. And then for the facilities, once again, what does provide adequate amount of safe drinking water means? It talks about getting a hold of local municipalities with regards to that. Because almost everyone, we actually, in creating this, I want to say, we put together all the accreditations from camps, as well as many of the municipal kind of guidelines, and kind of came up with this list of what should be seen and how they can do that from across the country in Canada. So it's pretty comprehensive, because we know that, like, for instance, in California, there are specific organizational laws. I know that in Montana, they don't have any for camp. So we had to cover both of those just to kind of illustrate what they need to think about. So it also talks about sleeping accommodations. It talks about hand washing accommodations and those kind of things. And for this, it says just to provide a ratio of participant to hand washing sink. It doesn't say how many sinks you want to have. Now, if you want to have one sink to 250 people, to be honest with you, that's the camp's choice, unless they're guided otherwise by municipalities. But we're just there to verify that it's there. And this is kind of our, I know it's tough as a visitor or somebody that runs a camp to say, really, is that enough toilets or is that enough sinks? But they need to determine what's right for them in their situation. What we're asking for is that they've thought about that. They've determined what's appropriate, because in our way, that then at least protects the camp from the part of view of, if there was an issue of unsanitation in the situation, of inappropriate sanitation, and they were called on that, they could at least say, well, we thought about this and this is what we chose. It wouldn't be negligence. It would just be not a good choice. So that's how these are kind of going through and trying to protect camps and actually think about some of these things. That was just an example. So there's also food service situations, trash removal, vector control, which are insects, rodents, and pets, for those of you who don't know what vector are. A safety plan with regards to if they use a pool, a lake, or any kind of natural body of water. So this appendix is really there, and this is very transparent. This is for the camps in the standards, and this is also for our visitors as they're taking a look and they're reviewing this kind of situation. And this will probably be the one standard that all of us as visitors this year will have to review, because they didn't know about it in 2020.
Do you all have, Brian or Jennifer, or I guess Ryan, you're just getting in the boat. Do you have a general feel for what percentage of our camps are going to need to do 1.1? Their site may be accredited, but their program is not. Because we fall into that category. I'm just wondering if you got a sense for how many other camps do.
I don't know, Jennifer, if you do or if Ryan does. I would say probably less than 50% are accredited on both ends by a camp, by a camp association, I would think. But that's just literally shooting from my hip, Dave.
Yeah, I had that. Yeah, I had that info somewhere, and I can dig it up and find out.
Well, for those who are going to fill out 1.1, I'm just curious how many of them are aware that the facility they're using probably has the kind of written description of emergency operations and so on that you're asking for. I know ours does, so that's not going to be terribly onerous. But yeah, if you're first time you're finding out you need to do 1.1, it may be a little overwhelming to think that I have to come up with policies for all this.
And just to let you know too, is that COCA actually held webinars with regards to just 1.1 for camps, and really stressed that those camps that were going for accreditation this year participate in that. That's been recorded, but we went through exactly that situation, Dave. Hey,
good.
You're using another person's camp. How do you get that information? Your camp may have that, but here's other ways in case you're charged with that. But the responsibility comes back onto the member camp.
Right, perfect.
Other thoughts, questions?
I think 1.1 certainly has the potential to be the most difficult aspect of a visit. And so the more warning we can give both to visitors and to camps, the better. And I think it's great that you've had those specific webinars to help camps deal with that. But the one encouraging thing, and I don't know how it's changed during COVID, but I remember from when we did a survey of the camps to find out how many were accredited and from where and which aspects of their program, the number who had an accreditation was higher than I had expected that it would be. Jennifer will find exactly what those numbers are, but I remember being pleasantly surprised that the problem was not as big as I thought it was going to be.
Yeah, and I also want to say that we've also realized that there's an educational piece that we're responsible for as COCA, because it is a fairly complex situation to think, oh, so hi, I'm COCA Camp A, and I go to Camp Watamaca and they're accredited, so I'm fine. It's like, well, what does the camp control and what does the member camp control, that you still need to have that documentation? And a matter of fact, to that end, within the COCA standards, there is also a worksheet just to determine that. What is a facility responsible for? What is the camp responsible for? To help provide guidance with regards to if they need to pursue in 1.1 some written documentation for whichever side is not accredited, that they can see what that line is, and it kind of guides them through that concept. Because just because your camp facility that you're using accredited doesn't mean that the member camp is accredited. Great. Well, we to be responsible for your time, only got a minute left. So is there any other thoughts, any other, words of wisdom to this wonderful group, or additional questions? Wow.
That link for the video about the 1.1 easily available? And
you know what we'll do, Tammy? Thank you for saying that. And I'm doing this on Ryan's stead. Is when we is that when we send out the information with that will have the COVID protocols, that will have this appendix, that will also have that worksheet, will include that 1.1 in recording to you as well, so you can review that as well.
Perfect. Thank you.
I would also want to say, just as I kind of click through these, because there's a few more if we had time, which we don't, but oops, I didn't do it. Well, I'm out of it. What I was going to say is at the end of the presentation is my contact information as well as Ryan's. So if through this process, and if you're even doing review and those kind of things, please immediately reach out to us. We'll be responsible to kind of help kind of go through and to make that happen.
I have one other question, I think. So with my visit that I did, I'm curious what your expectation is for how long is an average visit? Because some to what Dave said, that certainly people were anxious about us being there, obviously, but even trying to talk to them and just to see their experience, it was they were pretty guarded. So I do think that Dave's comment would be really helpful. But then I just wonder how much time do you think is appropriate to spend there? Because I certainly felt like they were really excited for us to wrap it up. So I just didn't know how long to put myself on them. So yeah.
I don't know. What would the group say? I don't know. I usually think it's like 4 hours.
Yeah. In the past, I had suggested to the visitors from like 9 to 1 or 10 to 2, because I think it's crucial that you're there during a mealtime, to see if there's any meds distributed to patients during meals, and, for you to get around to see activities and action, and, talk to campers while you're sitting in the lunch line, and to see, just how they operate.
And Jamie, I think, and to that, and thank you, Jennifer, but I think, Jimmy, also to that, I think it's the kind of thing of even letting them know, hey, want to be there long enough to be able to see those meds distributed, to be able to review some of this kind of information, to talk to a few staff, let them know that up front, and just say that right now you're anticipating, that it would take that 4 or 5 hours to do that, and over a mealtime, that kind of a thing.
Okay, perfect.
So they
Yeah,
kind of know what to anticipate instead of, oh, it's going to be an hour and they'll be out of here.
yeah. Okay, thank you.
The other thing
Wow.
that pertains to
I
that,
Go
was
ahead.
going to give you a shout out, Dr. Mike. I was going to say you and Brandon spent 2 days with us. It was glorious.
well, that was part of what I was going to say is that hopefully as the process becomes more familiar to more of the camps, that guardedness will disappear and people will just be welcoming peers to share their program and be excited about things and learn new things and teach some things. And it won't be so much of an issue. And we thoroughly enjoyed the 2 days that we spent with you, Dave.
We did too.
That was awesome.
Maybe
Well,
we were
Dr.
just
Mike,
that
I
bad that they had to figure, took them that much.
And do
That's
know
right.
that
We're
this is
just
why
that
we,
slow.
I was going to say, this is also why we've tried to see that most documentation is reviewed ahead of time.
Sure.
Because that can also trim down to be the quality of that interaction rather than going through a litany of paperwork
Right.
on site. Any
No.
other?
Was just stealing ideas.
Yeah. I don't like to say steal. I like
Yeah.
to borrow. But yes.
Borrowing.
Yeah,
Be
Great.
inspired by.
yeah, inspired by. Good call. Great. Well, with that, I'm once again 3 minutes over, but I appreciate all of your guys' time and going through this. You can look for an email from COCA that will have that information, that will have the information as promised, including that webinar. I appreciate y'all stepping forward. This program has been viewed as a very valuable program for COCA by the membership. And I think it's also very valuable with regards to helping those camps do the best they can do and even beyond. And you guys are the teams that bring it to life to them out there. So thank you in advance for those of you that are able to commit for us this summer. We truly appreciate that, and I know the camps do as well.
Looking forward to it. Thanks, everybody.
Thank you,
Good to see
guys.
you all.
You too.
Bye,
Bye-bye.
thank you.
Bye-bye.
Great one, Neil.